Well, good afternoon, everyone, and welcome back for my 41st daily briefing in a row. I must begin today by reporting that 125 more people lost their lives to COVID-19. To their loved ones, to their friends, and all who knew them, the state of Illinois grieves with you, and may their memories be for a blessing. Last weekend, I announced that those who have COVID-19 and are recovering at home anywhere in southern and central Illinois have access to a terrific new telehealth program that allows remote patient monitoring for COVID-19. That program now extends to the rest of Illinois, rounding out our telehealth coverage around the state. To remind you, this program serves those potentially infected with a mild version of COVID-19 who will be able to recover from the safety of their homes. Again, that's the vast majority of people who get infected. Patients will receive daily virtual visits by healthcare workers and receive wellness kits that include things like thermometers and pulse oximeters, blood pressure cuffs, and alcohol wipes. And to be very clear, the remote patient monitoring program is available to everyone who is COVID positive and recovering at home, regardless of your insurance coverage. Our new healthcare partner covering the northern part of the state of Illinois is Advocate Aurora Healthcare. Their hotline for this service is 866-443-2584. Again, 866-443-2584. You'll recall that Southern Illinois University School of Medicine is our partner serving communities in southern and west central Illinois, including Metro East, and their hotline number is 217-545-5100. And OSF Healthcare serves central and north central Illinois, also including Rockford, and their hotline is 833-673-5669. Those three phone numbers, as well as the websites for each of these providers, can be found on our COVID-19 website, coronavirus.illinois.gov, under the telehealth section of our resources tab. For many of you, this pandemic has been draining, emotionally and physically. And as I've said before, it's important to feel that and even share that with a friend, a family member, or a confidant. But it's equally important to look out the window, to walk outside, to look at all the hopeful signs, because those signs are all around us. And today I want to shine a spotlight on a few of those signs. Look at the creativity that people have brought to make sure that those in need are truly cared for. Like the Clearbrook organization in Arlington Heights, where staff at the special needs nonprofit have done everything from performing Corona caroling with ukuleles in their neighborhoods, delivering activity care packages to over 60 families, and sewing masks for their fellow employees. Like at Urban Autism Solutions, which created digital meetups for young adults with autism so that they can make friends and learn new things and have fun with a new and different kind of engagement. Like Kenny Farms Distilling in Rochelle, a family-owned business that decided to suspend their bourbon production operations and flip their systems to make thousands of gallons of hand sanitizer for their local heroes, their police officers, their firefighters, and their healthcare workers. Like W&W Towing in Dixmoor, where owner Early Walker has enlisted his drivers to deliver care packages to seniors on Chicago's South Side and in Chicago's south suburbs. Like at the Beverly Farm Foundation in Godfrey, a home for adults with developmental disabilities that has found socially distant ways to offer their residents bowling and puzzles and board games so there can be fun for the residents even while there is safety. Like the bipartisan coalition of lawmakers who teamed up with the Southern Illinois Community Foundation to launch the Southern Illinois Strong campaign, selling t-shirts and collecting donations to support area small businesses. Check out their campaign at southernillinoisstrong.com. Like the Illinois Board of Education, the Illinois Community College Board, and the Illinois Student Assistance Commission, which have together raised more than $550,000 to date for their emergency grant program to support low-income students across our 12 public university campuses and 48 community colleges. Like the Adams County Farm Bureau in partnership with local farmers, which donated over 2,000 pounds of ground pork to area food pantries in the Quincy area and across Western Illinois. Like the Syrian Community Network, which has implemented a remote case management system to provide assistance to refugees and their families all across the state over the phone and over FaceTime. Or like Family Focus in Aurora, which has redirected some of its funds and focus to connect families with state services, ensuring that families in their area in need of diapers or food or basic supplies can access what they need when they need it. That's the thing about Illinois. Everywhere you look, there are people stepping in to fill the gaps in other people's lives, being neighborly for their neighbors, being the kind of friend we want our kids to grow up to be. And just in case you need a little help finding it, I'll leave you with one last bit of joy. The Red Cross of Chicago and Northern Illinois was slated to host its 18th annual Heroes Breakfast next week, an event that had to be canceled because of COVID-19. Instead, the Red Cross is featuring on their social media pages members of the extraordinary 2020 class of heroes, people who make you proud that you're from Illinois. These heartwarming videos show just how good the people of Illinois have always been before and during this pandemic, and how good they always will be. And who knows, maybe the class of heroes for 2021 will feature some of you out there, people who have gone above and beyond on behalf of others in response to COVID-19. Award or not, you are the difference makers. You are the helpers. You are bending this curve and helping out our healthcare workers and saving lives, even just by staying at home. And I am so very proud of this state and of all of you. And with that, I'd like to bring up Dr. Ezike for today's medical update. Doctor.
Thank you, Governor, and thank you for taking the time to extol all the community organizations and individuals that are doing small and big things that all make a difference towards this effort. And to that end, I would like to just single out a friend in my neighborhood, Kate Meany, who is organizing people in our neighborhood to make masks. And she says, I want to make these masks if they will help people to be protected. And they will. I'd like to also thank all the team that worked tirelessly over yesterday and are probably still working on today to get test supplies to the FQHCs across southern and central Illinois. Clinics in Carbondale, Marion, Champaign, and Addison will soon be able to test their communities for COVID-19 and send those specimens directly to IDPH for quicker turnaround on the results. Individuals who live near these FQHCs will have testing available to them regardless of their ability to pay, regardless of their insurance status, insured, underinsured, non-insured, regardless of their immigration status. Our community-based testing sites in Harwood Heights, Markham, and Bloomington yesterday collected over 1,200 specimens. Thank you to the Illinois National Guard, the Illinois State Police, and our local partners for ensuring safety and order at these sites. With more access to testing, we will learn of many more positive cases. But that information is necessary, and it will help us to make the adjustments we need to provide the available resources and provide the support that's needed wherever it is across the state. Governor Pritzker has stood up here and told you how he has made the prioritization of testing at the forefront. And we need to make sure that that testing is available in all parts of the state, including our southern and central counties. As the governor has mentioned, unfortunately, we've seen today another day at our highest death toll of 125 lives lost to COVID-19. We also report an additional 1,585 new COVID cases. That brings our statewide total to 29,160 and a sobering 1,259 lives lost. Although our numbers continue to climb, it is with some guarded optimism that we say that the growth is slowing. That is definitely a good thing, but we must continue to be strong and hold the line. I know people are getting tired of hearing the same message, but the same tactics continue to apply. Continue to stay home, continue to wash your hands, wear a mask if you go outside. Let's keep up the progress we've made thus far. And now the similar comments in Spanish. Buenos tardes. Me gustaría comenzar el reporte médico de hoy con un gracias a nuestro equipo que trabajaron día y noche para entregar el equipo necesario para pruebas de COVID-19 a varias clínicas en el sur y centro de Illinois esta semana. Clínicas en Carbondale, Marion y Champaign pronto podrán dar pruebas a sus comunidades para detectar COVID-19 y enviar esas muestras a los laboratorios de IDPH para obtener resultados más rápidos. Las personas que viven cerca de estas clínicas en el norte, centro y sur de Illinois tendrán pruebas disponibles a pesar de su capacidad para pagar o de su estado de inmigración. Nuestros sitios de prueba basados en la comunidad en Harwood Heights, Markham y Bloomington colectaron ayer más de 1,200 muestras de individuos con síntomas de COVID-19. Gracias a la Guardia Nacional de Illinois, la Policía Estatal de Illinois y nuestros socios locales por garantizar la seguridad y el orden en estos lugares. Con más acceso a las pruebas, veremos más casos positivos aquí en Illinois, pero esa información nos ayudará a hacer los ajustes necesarios para enviar recursos y apoyo en todo el estado. Agradezco al gobernador Pritzker por ser una prioridad en acceso a las pruebas en nuestros condados del sur y centro del estado. Debemos reportar 1,585 casos nuevos y con tristeza 125 nuevas muertes aquí en Illinois. Esos causan en total de 29,160 casos en total, con 1,259 muertes totales. Nuestros números continúan subiendo, el crecimiento se está desacelerando, lo cual es alentador. Sin embargo, debemos continuar siendo fuertes y mantener la línea. Quédese en casa ahora y continúe con el progreso que hemos hecho hasta. And with that, I will turn it over to Governor Pritzker for questions.
Thank you, Doctor. Thank you. Happy to take any questions.
Hi, Governor. Will Jones from ABC7 here in Chicago. I'll start first with my questions. The first one, what would you advise people who are hoping to have weddings, reunions, memorial services, other family gatherings this summer?
It's difficult for me to advise people because there's so many uncertainties ahead of us. You know, we don't even know exactly where the peak will be. We won't really know until you're past the peak that you've hit the peak. And then as you've seen from various plans that have been put out, none of them really contemplate, you know, large gatherings until much after, not just the 14 days past, you know, when you've gone 14 days in a row of diminished numbers of hospitalizations and other cases and so on. But long past that actually, are when we would have large gatherings. So depending on the size of things, I would say, that people need to be, vigilant and keeping track of where we are in this process and making plans accordingly. And I wish I could be more definite than that. And it's one of the reasons why I couldn't weeks ago tell you exactly when or if we were going to extend the closure or the e-learning in schools to the end of the year, not because we just don't know what's happening from week to week until we see the numbers come through.
When do you think you will make a decision on whether to extend the stay-at-home order?
We're looking at it now. I mean, it's something that you have to look at all the numbers and kind of all the trends and make a decision about whether, and if so, for how long and under what conditions. And so I promise you, I get asked this question virtually every day, and I promise I'll give you the answer as soon as I know it.
This question is from Ben Bradley at WGN. As the weather warms up, are you inclined to help give people more opportunities to enjoy outdoor activities by reopening state parks, golf courses, as long as people can do those activities while social distancing?
Again, I'm personally inclined because I think all of us want to have a great summer, but I can't rely on my own instincts and my own desires, and instead, as you know, I've been listening to the epidemiologists and the experts here in Illinois, as well as the advice that we're getting from those who are not here in Illinois. And again, I'll make decisions about that as the data presents itself.
This is a question from Dana Rebick from WGN. Would you consider opening Illinois on a county-by-county basis, or will it be a statewide action?
I guess in short, I understand there are differences of the number of cases that are occurring in different parts of the state. And so I understand the desire to try to regionalize, and I'm looking at the data to try to make determinations. Remember, a lot of this had to do with and has to do with when you hit peak, are our hospitals going to be available to people who need hospitalization, ICU beds, ventilators. And so, trying to measure that, and where we are and what the ascent rate is here, because we're still increasing the number of deaths, we're still increasing the number of, we're increasing the number of total cases in the state. And so I've got to take all that into consideration and then look at, what hospitals are more available or less available as a result. I want to point out one thing, because people ask this all the time, and I just want to make clear that the rate of ascent of cases in rural areas seems to have caught up with and even surpassed in some areas the rate of ascent of cases in urban areas. And there are a number of places you can go to read about that. And so I worry a lot about, when I think about regionalization, I worry about that rate of ascent in rural areas where, for whatever reason, maybe people aren't following the stay-at-home order as much, or for whatever other reason, that rate of ascent is increasing. And so I want to make sure we're doing everything we can to keep the caseload and case numbers down in rural areas too.
My colleague John Garcia is working on a story today about nursing homes. What can be done to get those numbers down? So many people are losing their lives at those facilities.
Yeah. From the very beginning, really from before we had our stay-at-home rule in place, I called the governors of states where we saw, terrible nursing home tragedies, including Governor Inslee, Governor Cuomo, and asked them, what did you learn? What should I know as we start to put orders in place to deal with nursing homes? And they gave me tremendous advice along the way, and the CDC kind of has caught up with them, I have to say, and the advice that they gave me. And so we've put that in place. Way back when, in fact, nursing homes were locked down in the sense of no visitors. We were taking temperatures of everybody entering. We were checking on everybody in the facility. We were doing testing, and when there was, a new couple of cases that could be identified, we were, trying to make sure that we were separating people out, doing all the things that were being recommended by the doctors to do. So I'm frustrated by this, I must say, because nursing homes, it's very hard to deal with congregate settings. This is just something, to move them out is a challenge. To separate them, we can do that within facilities. Families can't take a COVID positive nursing home resident back into their home, right? And then it's very hard. Many people need services beyond just a place to live. They need nursing services, healthcare services, and you can't just move them, into a hotel room somewhere. And so these are very challenging, and we're doing, I think, the right things. We have a strike team that goes into into a nursing home when we discover that there's an outbreak. We are advising, we bring in specialists, infectious disease specialists, in fact, CDC infectious disease specialists, to make sure that they're wearing their PPE properly, that they understand what the procedures and policies now need to be in the facility, that there's an outbreak, and so on. But as you know, there are many people who are elderly who have comorbidities, and the age bracket itself is a kind of comorbidity, seemingly. And so we have a toll here that is higher than I think anybody anticipated or guessed, even with all of the lockdown procedures that we do.
My final question comes from Tia Ewing from Fox here in Chicago. She says, why won't the state buy PPE from local black vendors? Instead, she says the state has spent over $1.7 million to get PPE from China.
We'll take anybody with PPE. We'll look at them as a vendor. We're not avoiding anybody at all. The challenge is that there are no local providers that can provide large amounts, or at least, many people have come and said they could provide a few thousand here or there. We need to acquire millions of masks, for example. And so, and that's one part. And the other part is, as you know, when you get a larger number, a larger quantity of something, you can often get it at a lower price. I'm not saying the prices are low, where they've been bid up to prices that are ridiculous, frankly. But oftentimes what's being done by a small vendor is more expensive on a per mask basis than what we can acquire elsewhere. But anybody that has an idea, an opportunity to sell us PPE should be contacting our procurement team. It's easy to find us. You can call the governor's office. That's very easy, or you can call CMS.
Hi, Mike Puccinelli from Channel 2.
Hi, Mike.
So the Associated Press has a story out right now, and the headline is "Governor's Feeling the Heat to Reopen from the President." Are you feeling the heat to reopen?
I don't know what it means to feel the heat. I'm listening to the scientists and the doctors. I don't feel any heat. I listen to the people who know and who have informed opinions about what we ought to do. I will say that I think the plan that came out yesterday that Dr. Fauci and others presented, there are aspects of that plan that I think are pretty good. And so, I don't know if I feel heat. I'm going to do what's best for the people of the state. And, we're not yet at our peak. And so it's very hard to make decisions about what happens, 14 days or a month or 2 months after the peak.
Got it. You mentioned these strike teams. Did you send a strike team into Symphony of Joliet? And if so, what did you learn when your people went in there so that what happened there won't be repeated elsewhere?
Mm-hmm. I can't answer about the individual facility. Maybe the doctor can. Yeah. Thank you.
So we have had direct assistance given to Symphony. I know that, reviewing of all the infection control protocols, making sure that people know how to properly don and doff PPE, making sure that the pre-shift assessment, so there's a full survey that can be reviewed to make sure you identify the areas of weakness, and then, try to identify where IDPH can specifically support. We also have ongoing calls, regular calls with our infectious disease consultants from UIC, our infection control preventionists, as well as with their medical team. So that's like an ongoing thing that's happened in that facility and the many other facilities that have issues. So it's an ongoing process. Again, once the infection is in, it becomes a lot harder to control. So one of our thrusts going forward is really trying to get at some of the facilities that don't have any identified cases and see if we can work additionally to see if we can prevent the introduction in those situations.
Was the issue there a lack of PPE or perhaps improper use of the PPE?
No, I'm not giving the specifics of that case, but I'm saying that is kind of the approach that we use for every facility once we approach it, because it can be a combination of things. It can be none of those things. It can be staffing. So again, we try to use the same approach, but try to learn. We're looking at different kinds of strategies. We know as we're learning now that asymptomatic transmission is an issue, like that's informing some of the new protocols that we're looking at in terms of looking broadly at other people who may be not manifesting symptoms and looking at that. So again, we are involving every day as we learn and get more acquainted with this virus, and hoping that we can get to the point of preventing rather than trying to stave off an outbreak already in place.
All right, a final question for me for the governor. You had 2 weeks ago mentioned that this was Child Abuse Prevention Month. What are you going to do with the budget to address the need for increased child welfare services as the stay-at-home order is likely increasing child abuse in the state?
Well, I think you saw in the proposed budget, and I'm not suggesting that our budget for 2021 is going to look exactly like the proposed budget we put forward in February, but you know that I have prioritized child welfare in our budget, increasing staffing, increasing funding, and so on. And so as we look to revamp the budget and make sure that we're meeting the needs that we now know, we need to, in terms of balancing the budget and the lack of revenues coming in, I want to protect as much as possible the dollars that we're putting in to protect those children. So what I can assure you is that all of what our intention has been in terms of revamping DCFS is still there. I mean, all of us are focused on making sure that we're able to carry out the plans that we've put in place.
Hi, Governor.
Hi, Amy.
So in our attempt to save lives, we've destroyed millions of small businesses, millions of people's lives, and you keep talking about the scientists and the different phases. When were we going to get to phase one?
Phase one.
Phase one
We're-
of Trump's plan, phase one, phase two,
Yeah.
phase three.
Yeah, well, we're in phase one, I think. But I understand what you're saying.
Right,
In other
okay.
words, when do we move to
Move to
another
phase
phase?
two,
Yeah.
yes.
And the answer is, if you read in the plan, what they're essentially saying is you have to get past your peak, and then you've got to have 14 days of declining case numbers. And hospitalizations is really the way I would look at it. And as you have 14 days in a row of decline, then you can say, according to that plan, you can start to move into the next phase. And I'm absolutely, listen, I want to get there as fast as anybody does. We want people to get back to work. We want people to get back to their lives. The concern here is trying to balance, and I think you raised it right at the beginning of your question, trying to balance the protecting people's health and safety with trying to protect people's livelihoods. And very early on, I said, that some of the toughest choices I've ever had to make, these are choices between saving lives and saving livelihoods. And this is an ongoing challenge.
In North Carolina and in Florida, the governors there, they're letting people use the lakefront or the beaches. Is that, but they're doing it, from 6 to 8 or 6 to 11 in the morning, and then 5 to 8 at night. Is there any way we can have our lakefront back, please? Because it's making the streets so much more crowded, and it's, that's a lot of space that people use, joggers, bicyclists, fishermen, everything.
Yeah. I understand the question, and I want you to know I'm frustrated, as everybody else is, by the idea that that we can't enjoy the things that we've been enjoying every summer. When is it that we'll be able to do that? Again, I've got to measure this, and the answer to the first question that I got, when. I'm trying to measure this against the science. I want people to go out and enjoy their lives. I just had conversations with a number of downstate legislators who were talking about the fact that people can't fish in the state parks because the state parks are not open. And, couldn't people fish because, there's enough social distancing?
Right.
And of course, I completely understand. Remember that we did that with state parks because of the people who work at the state parks, because they have to congregate together. There's, a place in which many of them have to congregate in order to manage the state parks. And so, but I am looking exactly at those kinds of things. What are the rules going to be? You raised the question, what if people spaced properly and wore a mask or whatever?
Can we get another chance? I mean, that warm day was bad. I mean, people came in from central Illinois to go to the lakefront.
Yeah.
I think we deserve a second chance.
Oh,
prove ourselves.
I understand what you're saying, and I have every desire, I really do. And so like I said, every day we're evaluating, when, but I want to remind you that we are not even at our peak yet.
Okay.
And so we've got to get to the peak and start moving down the other side of it.
Okay,
ask
we've got to
the
get,
doctor
we have got to get to some of the questions online.
Okay.
This is from John O'Connor at the AP. What specifically do you like about the president's reopening guidance? What points from it do you disagree? What could Illinois incorporate?
Well, I think I just pointed out something that I like about it, which is looking at 14 consecutive days of a reduction in cases or the reduction of hospitalizations that would lead us to then be able to make some changes.
Jerry Nowicki at Capital News, Illinois. Senate Republicans wrote a letter earlier this week, which you've already addressed, but we're going to continue asking this question. Why some prison sentences were recently commuted without informing or consulting judges, the General Assembly, victims, or law enforcement. They note recent commutations include convicted murderers. With the recent commutations, are these related to COVID-19?
So I just want to be clear that those go through the PRB. They actually have a presentation of each case at the PRB. They vote on those cases before they ever get to my desk.
Okay. Shia Politico, did you talk to Senate President Don Harmon about the letter he sent to Congress asking for a bailout, and why weren't you a part of that ask?
I was not aware of the content of the letter before it went, there's no reason why a Senate president in Illinois can't send a letter to the delegation, I don't object to people communicating with our federal representatives. I do it all the time.
Okay. Rick Pearson had the same question, a little bit different. What were your thoughts on the letter, specifically the $41 billion ask?
It's different than what I have been talking to the federal representatives about. As you know, and I've said it here in front of you, talking about our budget, that I really believe the states need to have some unencumbered dollars that come in that will help us with the coming year's budget. Every state has this problem. It just does. And so, I don't object, like I said, to people, talking to our federal representatives with their opinions. I have certainly done that.
Rich Miller at Capital Facts has a question for Dr. Ezike. A study published in the Annual Review of Virology claims that low indoor humidity could be a problem for the virus's spread. 40 to 60% is apparently optimal. Is that being looked at for places like nursing homes, prisons, et cetera?
It's not currently. That's an interesting fact that I'm not aware of. There's probably additional study that needs to be done, probably not directly IDPH, but I hope that further research will guide us and we will follow results as they come about.
Jim Leach at WMAY. Governor, protests are being planned in the coming days against the restrictions you've put in place. What is your message to these protesters?
That I want to remove the restrictions as much as anybody else does, and I'm going to do it based on science.
Dan at WBEZ. Why didn't the state release the nursing home data earlier, and when did you realize nursing home cases were exploding?
We have followed nursing homes. Like I said, I made early calls about this. I mean, we knew that there were challenges in every congregate setting. So we have paid close attention and, in fact, have, as I mentioned, we have strike teams and protocols and so on that we put in place very early on. So there's no desire to avoid nursing homes, or, in fact, every focus that we could have, because we all know very early on, all of us, that it's our senior citizens who are most at risk. And so that's why we focused on nursing homes early. And we'll continue, in terms of publishing the data, we've had the aggregate data published for people. We were concerned about, in some areas, you're stigmatizing people who work at those nursing homes when you publish that is a nursing home that has an outbreak. You can stigmatize the families of the people who have relatives in those nursing homes, and we were concerned about that. But look, we also are very much in favor of transparency. I've been here 41 days in a row talking to you about everything to do with COVID-19, and we're pleased to put all of that data online so that people can look at it now.
A.D. Quigg at Cranes will be our last question. Trump's special assistant, Judd Deere, suggested you were either ignorant, incompetent, or had a propensity to over-politicize your criticism of resources from the White House. How short is Illinois from what is requested from the federal government today?
Well, I think we've received, in terms of PPE, we're, I think, under 3% of the PPE that we asked for has been delivered by the federal government. Meanwhile, you've heard me say over and over and over again how proud I am of our Army Corps of Engineers, of our Army, of the FEMA, and the work that they're doing with us. I've been very pleased with a lot of the things that we've gotten, and the challenge has been when the White House makes a promise about something and then doesn't deliver, and then makes another promise and doesn't deliver, and then the president stands up and criticizes people, but he's not delivering. That's obviously irksome. Having said that, I'm very proud of the people who work at the other levels of government who have delivered for the state of Illinois.
All right, thank you, everyone.
Thank you.